My name is Ryan Parks, and I'm going to demonstrate how to do a neurological assessment. So for this video, I'm going to be using my pillow as the example. First thing I would do is enter a patient's room and perform hand washing and apply clean gloves. After that, I would introduce myself to the patient. So my name is Ryan. I'll be your student nurse today. After that, I'm going to say, I just need to verify some information. Can I get your name and date of birth? After that, I would check the patient's ID band just to make sure all my information is correct. Then I will explain the actions that are part of the neurological assessment to them. And if they agree to that, then I will do a safety check, make sure the wheels are locked, the call bell is in with reach, and just make sure the bed is at a workable position and that everything else is in order. After that, I will close the curtain, and I will ask the patient if he or she is having any pain, and if they are, on a scale of 0 to 10, can you rate it for me? After that, I will look at the signs and symptoms when I'm really doing the assessment to narrow down what I'm going to do. And as I said at the beginning of the video, I'm just going to be doing a neurological one today. So when getting into the assessment, the first thing I would check for is to see if my patient is alert and oriented ×3. So I would ask 3 questions. Can be like anything, but for me, I would say, do you know who the President of the United States is? Do you know where you're at? So if at hospital, doctor's office, whatever. And then my last one will be, do you know what year it is? And if they answer those 3 questions correctly, or if they're very close to the answer, then you could say they passed that part of the test. Next, I would check their vision, see if their pupils are reactive to light, things of that nature. So that's called PERLA. My phone is being used right now to record, so I don't have like a light, but I would take the pillow. I don't know if you can see that, but these are like the eyes. We'll just pretend for now, but I would just have a pen light. I would just go from either the left side to the right side and then back with the pen light on, checking to see if the pupils are reactive to light. And then after that, I would do, it's called EOM, just to see the patient's eyes and to see how they would react to my finger moving. So keeping their head straight while their eyes are also moving to the direction that I'm pointing to. So it would look something like this. Let's start here, go up, down, left side, right side. Okay, come back. Okay. After that, I would make sure the patient is able to perform hand grasps and move their extremities. So I would say, don't let me push you down for the legs. And on their hand, I'd be like, don't let me push you back. They push me back. And then I would grab their hand and be like, grasp my hand, and then flip over and then do the same thing. And then also I would perform Romberg's test. So I'd have the patient stand up with their eyes closed, standing straight, just to check their balance and make sure everything is okay there. After completing that, I would ask the patient if they had any questions for me. Depending on that answer, if it's a no, then I would put the patient down into their bed, make sure everything is at the way I found it. So make sure the wheels are locked, call bells within reach, bed is in the lowest position. And after that, I would make sure that I would document all of my information. And at the end, I would again perform hand hygiene, take off my gloves, and that's about it. So that is a neurological assessment for nursing. All right, thank you for taking your time to look at this video.